Welcome back to Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park. Today we will be discussing the steps involved in a crown procedure.
Yeah.
A crown is placed on a tooth for a number of reasons. Dr. Sharma, what are some of the reasons?
Well, there are multiple reasons. Well, there are some fractured teeth, cracked tooth syndrome, large filling, multiple cracks on teeth, root canal treated teeth, a weak tooth. So there are plenty of reasons, and that we'll get back in details in another episode.
All right. Well, what are some of the steps involved in a crown preparation?
Well, crown prep can be done in one visit or two visits.
What's the difference between 1 and 2 visits?
Okay, so one visit is when you do the crown same day from start to finish in the office, and then the patient walks out with a new crown. 2 visit is when the patient walks out with a temporary and comes back for the permanent crown.
So let's talk about the steps involved. Before we begin, an x-ray is always taken prior to the appointment to check for infection at the tip of the root. Also, the insurance company requires an x-ray to approve the crown.
Yeah.
We will also take an intra-oral photo and go over the consent form. Let's talk about the 1 visit appointment now. What is involved in that?
The procedure takes about a couple of hours or more, so be prepared to have a field trip in the dental office. We first place a topical and then numb the area. The crown preparation is done by shaping a tooth a couple of millimeters all around in order to make room for the porcelain. Gum tissue is then treated with laser or by packing a cord around the gum, so the gum moves away from the tooth structure so we can capture the margins so we know where exactly the crown fits. So before we scan the tooth, we make sure that the area is really completely dry. So we place a lot of cotton and gauze, and then we scan and just make sure that we get each and every detail. So once the scanning is done, we of course take the cotton and gauze out, so be prepared to have a dry mouth.
Yes. After the scanning is done, the cord that was placed is removed. Once the tooth is scanned, it is then taken over by the lab tech who designs the crown, which will take a few minutes. Then it is milled. It takes about 15-16 minutes for the milling. After it is milled, it is tried on. An x-ray is taken to make sure all of the margins are closed and it fits perfect. If something is not right, then it is corrected. After the correction is made, it's remilled and seated.
So after the crown is being tried and it looks good, we put it back in the oven so it's glazed. It's placed in the oven for 12 minutes and then we know it's ready. After it's cool, we treat the tooth by etching the crown, prepare the tooth with a bonding and a desensitizing agent. A cement is placed inside the crown and placed on the tooth. We cure that with an ultraviolet light. Excess cement is cleaned from around the crown and the tooth. So there you go. These are the steps involved in a crown preparation.
Okay, so that's the 1 visit. How is that different than the 2 visit appointment?
Oh yes. So now the 2 visit is when we send the crown to the lab. That's slightly different. The only difference is that after the preparation is done, a temporary is placed, and it will be around 2 to 3, or maybe 2 and 2.5 weeks to get the permanent crown. A lot of times that we do, patients don't want to stay in the office for 2 to 3 hours when we do the same day. So what we do is they go home with a temporary, but the temporary lasts in the mouth for maybe a couple of days.
If you are wearing a temporary crown, here are some instructions and tips on how to care for your temporary crown. Do not chew on that side. If you floss, drag the floss through your teeth. Do not pull it upwards. Don't chew any hard or sticky foods. If your crown does come off, call the office immediately. If you are unable to come in right away, you can purchase some over-the-counter temporary cement. So to use that, make sure you dry your tooth and the crown with a paper towel, place a small amount of cement in the temporary crown and put it back in. Take note to make sure you're not placing the crown backwards. That's easy to do. If you're unable to purchase the temporary cement from the store, simple toothpaste will suffice. If your temporary crown cracks or breaks, call the office immediately. If you have an appointment for the permanent crown in a day or 2, let the office know. They may just ask you to wait if there's no pain or sensitivity.
So there you have it, all the steps that's involved in a crown preparation and how to care for your temporaries.
Yes, and if you have any questions, as always, give us a call. Thank you.